September 19th, I started feeling what I thought was flu-like symptoms, cold sweats, shaking, vomiting, and so I took myself to a local hospital. They thought it was regular pneumonia at first. It turned out to be a new form of pneumonia, not just regular pneumonia. It was a result of the vaping. It was the worst 2 weeks of my life, and I genuinely thought that I was going to die. I'm basically here because I don't want anyone else to go through that. It wasn't fun. People have died, and it's not a joke.
Today we're launching this new campaign, Take Vape Away, for one very, very important reason: to protect our children from a potentially deadly threat. More than 1,000 people have been hospitalized across the United States with vaping-related illnesses. 23 people have died, sadly. More than 1/3 of the patients are aged 20 or younger. We have seen them right here in our own hospitals and in physicians' offices. And keep in mind, this is just the tip of the iceberg. That's why we are taking this important action and calling on others to join us. We are committing $1 million to start, and here are a few of the details. We created a new grant program to give schools and community groups up to $7,000 to help combat youth vaping. They have several options. They can buy back devices and cartridges, or create special programs to warn our youth of the hazards. They understand the needs of adolescents in their communities best, so they can tailor the most effective strategy to tackle this problem. We are training 50 nurses as health educators to reach students at 100 schools throughout the state of New Jersey. Our School of Medicine, the Hackensack Meridian School of Medicine, will conduct a comprehensive 18-month study to determine best practices in warning youth of the hazards of e-cigarettes. This is really important, not only to address the immediate impacts of vaping, but to stop kids from ever smoking real cigarettes.
Vaping has become something that is looked at as being so popular, but it is exceedingly toxic to the lungs. In some samples, there has been formaldehyde and diethyl. Diethyl is, if you may remember, is popular from quote-unquote popcorn lung. That's just to name two chemicals. The bottom line is there's lots of toxic pathology associated with vaping, but to simplify it, there's an inhalation of a toxin. That toxin causes acute inflammatory changes in the lungs. The body is basically prevented from picking up oxygen and sharing it with the lungs, cannot pick it up and distribute it to the rest of the body. This leads to respiratory failure. Now, as a father and as a physician, specifically one that specializes in taking care of the lungs, it will take a multidisciplinary team to combat this. But we need to be aggressive, and we need to make the young children, young youth, and young adults aware of the potential hazards, and those hazards are real. When we ruled out viral and bacterial causes of acute respiratory failure, in all of the 6 cases that we've seen in the last 4 months, the common thread has been recent or near recent initiation of vaping. Now, you never want to practice evidence-based medicine. You always want to go to the literature. And I believe, as mentioned just moments ago, the literature is just seeing the tip of the iceberg on how toxic and deadly this is to our youth.